Hotlines from 9 Health, and this is Health Happens, our weekly Facebook Live show that we do every Tuesday at 11. And today we are with Tony Saiz, and we are going to be talking about health costs and prevention, and how prevention can help you avoid high health medical costs in the future. So chronic disease has specific health and economic costs in the United States. Preventing chronic disease and kind of managing those symptoms when prevention is not possible can really help reduce costs in the long run, in the long term. Many of us know that it can be super expensive managing medical issues and disease, but unfortunately there are many Americans that are still not taking preventative health measures to kind of avoid those diseases and health issues. Can you talk about a little bit about some common issues like costs associated with health and economic issues?
Yeah, I mean, I guess I could start off with diabetes. Diabetes is one of the most talked about issues in disease management, especially when it relates to cost. The average prescription cost for disease management can vary greatly, but diabetes is one of those diseases that can have significant health costs.
Right, and the cost for the average American is about 2.3 times greater to manage that specific disease compared to those Americans that do not have diabetes, correct?
Correct, yeah, and according to the ADA, the American Diabetes Association, the average cost that a person with diabetes incurs yearly is over $16,000.
That's pretty significant, and with the cost of insulin, which is a huge portion of managing that specific disease, that's quite a bit of money.
Quite a bit of money.
Quite a bit of money.
Yes.
So it's really important to kind of focus on preventing diabetes if you can, but kind of just like watching your numbers, knowing like what your A1C levels are, and just kind of keeping tabs on that. That's why prevention is so important, to kind of avoid those enormous costs.
Yep, very, very, very much so.
Okay, perfect. Can you give us a kind of idea of some other costs that are associated with very common health issues, like maybe heart health and hypertension? Things like that? Yeah,
so heart disease, high cholesterol, hypertension can lead to cardiovascular disease and stroke. According to the CDC in 2010, the cost of cardiovascular disease and stroke was $440 billion back in 2010, so it's quite expensive.
That is quite expensive. Goodness gracious.
Yeah, very expensive.
So all the more reason to focus on your prevention.
Correct.
Yeah, stay on top of that stuff so you don't have to deal with those high costs in the future and down the line. So when you compare those costs with the cost of actually going to get these preventive health services, do you think that there's a pretty significant cost savings between the two?
Yes, absolutely. The cost that you can save in the future from not having to manage those health concerns through other medication, multiple doctor's appointments, potential surgery, there is significant savings that you can receive by understanding and improving your health.
Perfect. Now, I know before we actually started the interview, we were talking a little bit about family history and how knowing your health risks for specific diseases is important, but also it informs, it allows you to kind of do a little bit more research about the cost of those specific diseases, just so you're prepared in the event that those things do actually occur.
Yeah. Yes, I mean, let's say you have a family history of a certain disease, there's a potential for you to also get that disease. You're also at risk for potentially getting that disease. And not only that, equally important is the cost that may be associated with that disease. So for many, it's a big motivator for them to focus on prevention as they go forward. So understanding that you may be at risk for a particular disease and the potential cost is highly motivating for anybody to make changes and to really focus on that preventive health.
Right. And getting those preventive health services really does make a difference. So you are fully informed about things that you can do to kind of like reverse or avoid those specific diseases, and ultimately the cost.
Yes.
So, which is really important.
Which is very important.
Yeah,
Could be,
yes. Absolutely. And even for those who do take the recommended preventive measures, sometimes you're just predisposed.
You're predisposed. That's right.
So
your genes. Yeah.
Exactly. So you still might get it. So it's still important to know and be educated on the cost of that, so you are prepared financially to take care of that and make sure that you're getting the right kind of like insurance plans and things along those lines.
Doing your research.
Research is very, very important with this,
With being preventive health.
Exactly. Yes, absolutely. So for people who are trying to learn more information about the cost of managing health issues, what are the resources that people can use? Should they go to a doctor, a pharmacist? What are the options?
That's great. Yeah, and I would start there because there is plenty of information out there, and it's just who you want to reach out to. You can reach out to your primary care physician. There's nurse care practitioners. There's physician's assistants. Even your local pharmacist can guide you and help you and answer any of your questions. And there's also some reputable websites, such as the CDC and the American Diabetes Association, that has some valid information out there as well.
That's perfect. The important thing is that you have to be able to ask the question.
Yeah, that's right.
If that person can't necessarily answer that question for you, they can find an avenue for you to get the answers that you're looking for.
That's right. They can direct you
exactly
to the right location.
Yeah, absolutely. Yeah. Now, with all of this knowledge, we're trying to empower people to focus on prevention. So how does this knowledge empower people to maintain their health or improve their health overall?
Okay. Yeah, well, knowledge is key. The more that you empower yourself, the better that you can be health-wise, right? You can make better decisions. You can become more proactive with your exercising and understanding the risk factors, like you kind of mentioned about before, is understanding what those risk factors are and to maybe avoid them or eliminate them altogether.
Right.
So that's the most important piece of that, is understanding what can cause that.
Right.
Yeah.
Perfect. Let's see. Now, do you have any other additional advice that you would like to share with our audience regarding prevention and focusing on health costs?
Yeah, regarding preventive health, I mean, the biggest thing is to ask questions, right? Do your research. Make those lifestyle modifications if you need to, understanding those risk factors. If you're on any medications, to take them as prescribed, any and all medications as prescribed. Another preventive health service is the flu shot. If you haven't received a flu shot, that's something that can help prevent you from getting the flu later on, so that is still available. But really just seeking that advice, right? And understanding what that is to prepare for anything that's coming down the road, right?
Exactly.
So, and to mitigate some of those risk factors if possible.
Yeah, and just having that knowledge base, like a starting point.
Yeah,
like,
absolutely.
this is exactly where I am with my health. And these are the numbers that I might want to be paying attention to, just so I can avoid those, large but very common diseases.
Very common.
So, all right, perfect. And I did want to ask you an additional question regarding family history. So. That can be a very difficult conversation to have with family members about disease.
Yes.
Now, are there specific questions that we should try to ask to kind of get that information out?
Of your family member?
Yeah, family members.
It's very touchy sometimes when you're talking to a family member, but you would think that they would want to trust you. And again, seeking that information to be able to communicate that to them effectively so that they understand, wow, yeah, I really may have this, or I really do need to do this. I do need to change my lifestyle. I need to make better food decisions. I need to increase my exercise. And then maybe having some examples as well. Maybe some previous members in your family had something that caused some kind of, maybe even a death or something like that, to kind of reference back and say, hey, we want you to be around for a while, so definitely need you to make some changes.
Yeah, definitely. And that's always a difficult conversation, but still it's a very important piece, a part of the preventive health journey. You have to know that stuff. You have to know where you're starting. Also, it helps to get the preventive health screenings, which are offered at the 9 health fairs. They're not running right at this moment, but they're coming up in spring, so stay tuned. But yeah, I mean, those are very important factors that we need to have, and
very important
knowledge that we need to know to make really important health decisions.
Make some sound decisions.
Plan for other diseases that may be coming down the line. So, perfect. All right. If you have any questions, make sure that you put them down in the feed, and we'll answer them as we go along. Did you have anything else that you wanted to add, Tony?
No, just really, like I said, just to really do your research, ask the questions, seek out that information from reputable sources, of course, and then make those decisions. Make those lifestyle modifications if you need to, and that's the best advice that anybody can give you, because it really comes down to yourself, not other people, but really you owning that.
Yep, absolutely. And it does does impact your family members and your friends because, you know, you
Sure
want to be
does.
around for a long time.
That's right,
So
yeah.
if you don't know, then, you know,
right.
you might not be around as long as you want to be.
That's
and
right.
be around for your family and your friends and
Yep,
things like
that's a good
that.
point.
Perfect.
Very good point. Yeah.
All right. Well, I think we are going to go ahead and wrap up. Thank you guys for joining us. And thank you, Tony,
You're
for
welcome.
joining
Thank
us
you.
today. It was very insightful. So be sure to join us at Health Happens every Tuesday at 11, and we'll see you next time.
Goodbye.